all. This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield. Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director for Regence Blue Cross Blue Shield of Utah. Good to see you as always, Dr. Hiatt. I want to start with talking about what the CDC panel is advising about FluMist. What are they saying this year?
Amanda, last week a government panel, that is the Centers for Disease Control and Prevention, or the CDC, recommended last week that FluMist not be used in lieu of a flu shot for treating or preventing the flu.
So what's the difference between the mist and the shot?
Well, FluMist, of course, Amanda, is sprayed into the nose, whereas the flu shot, of course, involves injection by needle.
So why did they recommend against the mist? Why?
Well, it seems like the mist is a better thing. It hurts less. The problem is that it's simply not as effective. Last year, the FluMist was about 20% less effective than the shot.
Can we change topics? I want to talk about fake health news. You know, we hear the phrase fake news all the time, but it seems like, and I saw this article in The Atlantic, fake health news could be the most serious fake news of all.
It could be. Of course, we've all read or heard these misleading stories about secrets for weight loss or for reversing wrinkles. Now, there's also, as pertaining to health topics, what's called junk news.
What do you mean by junk news?
Well, junk news are conclusions that aren't necessarily supported by the studies being reported. So, for example, when you have a study performed on mice in the lab, then to draw a conclusion about the relevance to humans is not necessarily a sure thing.
So what are some good sources for health news?
Well, Amanda, of course, This Medical Moment and other such segments on KSL.
Right. Before I let you go, I want to bring up one other topic, and that is fighting inactivity. That has become a focus for people of all ages, correct?
It has. You know, a recent study actually published earlier this month reported that adolescents are more sedentary than 60-year-olds.
Okay, that freaks me out. So what is the recommended guideline for exercise in children?
The World Health Organization recommends at least 60 minutes of moderate to vigorous physical activity a day for children and adolescents.
And most of our kids are not meeting this.
They're not. No. The majority are not. That's very unfortunate. So the thing to do today, even though it's hot, is to get out there.
Get out there, go swimming, get out there, jump on the trampoline set.
Yes.
It's always good to see you, Doctor. Thank you. This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield.